Ladies, if you've noticed unusual bruising on your arms or legs lately, don't brush it off as just old age. Some bruises are trying to tell you something, and ignoring them could be a dangerous mistake. In this video, we're diving into 7 types of bruises older women should never ignore after 65. So grab a cup of tea and stay with me to the end, because one of these may just save your life. And before we jump in, don't forget to like, subscribe, and comment below. I check my bruises now. Let's look out for each other. 1. Spontaneous bruises with no memory of injury. Let me tell you, this one gets most of us. You're folding laundry, sipping tea, living your life. Then you glance at your arm and bam, a big purple bruise is right there. No bump, no trip, nothing. It's easy to write it off, especially when our skin gets thinner with age. But bruises that come out of nowhere, they can be a red flag. These types of bruises may be a sign of low platelet counts, vitamin C or K deficiency, or worse, an early indicator of leukemia or other blood disorders. Now, I don't say that to scare you, but to empower you, because I had a friend, Marjorie, who kept finding these random bruises on her thighs and arms. She thought it was just old lady skin, but when she finally mentioned it at a checkup, her doctor found a serious issue with her blood. She got treated early, thank heavens, but only because she stopped brushing it off. So if bruises are appearing without reason, don't dismiss it. Make a note, take a picture, and bring it up at your next appointment. 2. Bruises that don't fade after 2 weeks. You know how bruises usually behave. They start off purple or blue, then turn greenish, then yellow, then gone. A nice, predictable fade. But if you've got a bruise that stays dark, swollen, or stuck in one color after 2 weeks, that's a problem. I'm not talking about a tiny mark here and there. I'm talking about larger patches that just refuse to heal, like your skin pressed pause on recovery. This can be a sign of poor circulation, which is more common as we age, especially if you have diabetes or vascular disease. But it could also mean your body isn't clotting blood properly, something that can be triggered by medications like aspirin, warfarin, or even herbal supplements like ginkgo. And yes, in rare but real cases, melanoma, skin cancer, can mimic bruises that don't go away. So here's my rule. If a bruise hasn't started to change color after 7 days, and it's still hanging around after 14, you bring it up with your doctor. Full stop. 3. Raised or lumpy bruises. Now this one's especially tricky because most people expect a bruise to be flat. But have you ever had one that felt like a small knot or lump under the skin? Maybe even tender to the touch? That's not just a bruise. That's likely a hematoma, which means the blood didn't just leak under the skin. It pooled. Hematomas can happen after a hard bump, yes, but they can also form from blood pressure spikes, blood thinners, or even minor strain. I once had a hematoma on my shin from bumping into a bedpost. I iced it and ignored it for a week until the swelling got so bad I could barely get my pants over it. Turns out the pressure was building and could have led to nerve compression if I hadn't treated it. If a bruise is raised, painful, or getting bigger, get it checked out. It may need draining, or it may signal something more serious, like abnormal clotting or blood vessel damage. Listen to that lump. It's trying to tell you something. 4. Bruising that comes with other symptoms. Now this is where your gut really needs to speak up. A bruise on its own, maybe not urgent, but a bruise that shows up alongside other symptoms. That's when the alarm bells need to ring. I'm talking about things like feeling constantly tired or dizzy, bleeding gums when you brush, frequent nosebleeds, small cuts that take forever to stop bleeding, or even unexpected spotting or discharge. When these come with bruising, especially large or spontaneous bruises, you could be looking at a serious blood disorder like anemia, ITP, or even a sign of internal bleeding. I remember a woman I met at church who had these bruises on her legs and always seemed out of breath. Turned out her iron levels were dangerously low, and she'd been ignoring the bruising for months. Don't be polite about your body. If it's talking, listen. And if it's shouting with bruises and other issues, go get seen. Now, 5. Tiny purple dots, petechiae, that don't fade. Now, this one can be easy to overlook because these little spots are so tiny, almost like freckles or tiny pinpricks on your skin. But these aren't freckles. My dear, they're called petechiae. They look like clusters of tiny red or purple dots, often on your arms or legs, and they don't disappear when you press on them like regular bruises do. That's a key difference. Petechiae happen when tiny blood vessels called capillaries burst, leaking blood under the skin. Sometimes it's harmless, like after a hard cough or strain, but often in older women, especially those over 65, it's a sign that something's going on inside your body. These spots can indicate blood infections, platelet problems, or even inflammatory conditions like vasculitis. And if you're on blood thinners or other medications, they could be a sign your blood isn't clotting like it should. If you notice petechiae spreading, multiplying, or sticking around for more than a few days, don't wait it out. Take photos, keep notes, and get to your doctor quickly. These tiny dots might be small, but their message is huge. 6. Frequent bruising around the wrists or hands. Here's one that many of us dismiss because we think, oh, it's just my fragile skin. But if you're seeing frequent bruises on your wrists, the backs of your hands, or your forearms, especially from very minor bumps, or even just from everyday use, you might be dealing with something called senile purpura. Senile purpura happens when the connective tissue under your skin weakens, causing blood vessels to break easily and leak blood under the surface. And this condition isn't just about aging skin. It can be worsened by things like long-term use of steroids, sun damage over the years, or chronic health problems like diabetes. I remember when I first noticed these bruises on my hands, I thought I was just clumsy or that my skin was thinner. But after chatting with my doctor, I learned it was actually a sign that my blood vessels were more fragile than they should be. If you're on medications like blood thinners or anti-inflammatories, this bruising can be worse and can also hide more serious bleeding risks. So if your wrists and hands bruise more easily than before, don't just shrug it off. Mention it to your healthcare provider and review your meds and sun protection habits. 7. Bruises that hurt more than they should. Finally, let's talk about pain. Some bruises hurt. That's normal. But if a bruise is causing you deep, persistent, or sharp pain more than you'd expect from the size of the bruise, you need to pay attention. Painful bruising can signal issues deeper than just broken blood vessels. It could be a sign of deep vein thrombosis, DVT, which is a blood clot forming in your deep veins, especially in your legs. DVT is dangerous and needs immediate medical attention. Other times, painful bruises may be caused by nerve involvement or compartment syndrome, where swelling within muscle compartments causes pressure, restricting blood flow and damaging nerves. If you notice your bruise is warm, red, swollen, and hurting more and more as time passes, don't wait. Call your doctor or head to urgent care immediately. Trust me, pain isn't something to be tough about, especially when it comes to bruises that just don't feel right. Now listen, my dear, bruises may seem like harmless skin things, but they often tell the story of what's going on underneath. After 65, everything in our body becomes more delicate, including the signs we get. So take them seriously. Keep track. Take photos if needed. And most of all, speak up. And if this video opened your eyes, share it with another senior woman you care about. Make sure to like, subscribe, and drop a comment. Backhand index pointing right. I won't ignore bruises anymore. And if you haven't already, sign up for my free Savvy Senior newsletter, where we talk all things aging, health, and independence every single week. Stay wise, stay well, and stay bruiseless.